Yes, sir.
So meeting is just for us to know who are here and interact among the candidates so that we may know ourselves, at least if not facially, at least by name and by what we do. So
Okay.
since you are the only one on this call, we just interact for about 5 minutes and then we'll call it a wrap, and then you prepare for your 10 o'clock lecture with Dr. Yemi.
Okay, sir.
So you can put on your video so that we can see your face.
Okay, sir.
I'm sure you are seeing my face. So
Yes,
you can
I am.
also and then introduce yourself, who you are, where you are, what you do, why this course, and stuff like that. So once again, my own name is Olawale Atere. I'm the head of membership and professional services of the Chartered Institute of Social Practitioners of Nigeria. So I'm in charge of getting prospective practitioners into the profession through the social work professional certificate examination, and it's in their various categories and forms. This is one of the categories for those who are in the directorate level, okay, in their respective ministry, department, or agency, and private establishment. So, and I work with Federal University of Allied Health Sciences, Enugu. I'm a lecturer, I'm a senior lecturer in that institution. So anyone that wants to come.
So is that where they are doing the the induction?
Yeah, that's where
the conference.
Yes, we are the hosts. Yeah.
So wow.
Like the SWPCE is a mandatory program for anyone who wants to practice social work in Nigeria. Like every other meaningful profession, you don't just get qualified to be licensed just like that. It's not an association. As an institute, you need to go through some training. However, it may be brief, it may be extensive. So after that, such persons will now be invited for induction if the person passes. So like I was saying, we have array of programs for those who want to become professionals, professional social worker in Nigeria. We have what we call the Foundation Professional Examination. We have the Intermediate Professional Examination. Then we have the Final Professional Examination. And that is the final for anyone to be inducted as associate and then be able to apply for practice license. But the council of the institute find it worthy to not lump those who have spent about 25 years in service, who are in the directorate cadre, that is directors, deputy directors, assistant directors, because they have spent a long time on the social work desk in Nigeria, and that because many of them will soon be retiring, and from where we are now, it will not be good for them to get a retirement point after spending 20, 25 years, and then they are asking for social work qualification and they don't have it. Well, that is where social work is going to in Nigeria now. It has been experimented in some states, which gave us concern that many people who even retire as permanent secretaries had problems after they retired. They were asking them now to bring their social work qualification and license. Some of them don't have, and they have to slash their benefits drastically. It was not a good story to tell. And some who were wise, but yeah, some who were wise, before they got to that point, 1 year or so, they quickly did that and they were licensed and they have a smooth sail during their retirement. So having worked for that and you say you have done social work all these years and you just go home with little or nothing. So that's designed this, even though those in that category may not have social work qualification as in degrees, that is called social work, or they may not have allied discipline, but they have degrees, one degree or the other. That is why this master class was designed for them to go through it, they will be assessed. After the assessment, if you find them worthy, they will now be inducted. And then with that induction certificate and the certificate for the exam for this training, they will now use that one for to now apply for their license. Means that they have one qualification from the Chartered Institute to cover them during their retirement. So that is what we have done. For other categories, like I said, the FIPE, that's final professional examination, you cannot go into it without having social work qualification. And those who are below directorate cadre, whosoever you are, you must have either social work, sociology, psychology, adult education, girl and counseling, and community development. So those who have that are taken into the final professional examination, so that after they have done that, they get inducted and they can use that to now apply for their license. So this program is very germane. We are hoping that many others in the directorate cadre will key into it. This is the second diet. The first diet, we have a few as well who keyed into it. The second diet, I think we have about 5. But I think in Delta State, we'll be having about 14 of them trained next week. But that will be on ground for their training. Then in Abia State, we have about 24 of them to be trained offline. So we'll go there and train them for 1 week and then assess them as well. So people are now waking up in trickles to get that done. It's not for our benefit, but because we have the qualification, but many people do not have the qualification, and we have the federal government law that talks about that. So no one in social work condition now, if you don't have a license, you are not a practitioner, you are not a professional. You have business, or if you even have your license and your license is expired, you don't have any business practicing. You must just be up to date in your practice. So that is why we have come to that point, to this point of masterclass program for those in this case. It has been advertised severally for people to be aware. And the way we are going now, the next level is for us to ensure that ministries, departments, and agencies conform to the law of the Federal Republic of Nigeria on social work issues, which is what we have in the Act 25 of 2022, that anyone who will practice social work in Nigeria must so be licensed. And for those who are in directorate cadre, they will be writing projects, they will be signing documents, and like, if they don't have license, and they don't even have, after license, there's what we call stamp and seal. You cannot do anything. You go to court without your stamp and seal. Somebody wants you to write a report for him as a director or as a social worker, and you don't have your stamp and seal. He cannot fly in Nigeria as we speak. But we have not come to the point of enforcement. We just want to ensure that we carry
everybody along.
People are along, and we have advertised it severally. We have written to ministry department agencies. We have written to the development partners on all these for them to know But by next year, hopefully, we may be entering the enforcement stage, where we also write and physically visit ministry, department, and agencies for compliance to the law of the federal government on social work. If not, we will not be doing well. So I'm saying all this so that as a matter of orientation to know why we are in this program. So having introduced myself and introduced the program, I'll just say a little more on it. May you please introduce yourself. Thank you.
Thank you, sir. Thank you, sir. I don't know if you are hearing me, sir.
Yes,
thank you. I
clearly.
really appreciate it. Okay, I appreciate you, sir. Yes, my name is Mrs. Aduke Evesi Ogunshemore. I am a deputy director in social works in Federal Medical Center, Asaba here. I'm the assistant HOD. And so far, so good. That's what we do. I want to ask a question.
You are in the medical social work practice?
Yes, medical, yes, sir.
Oh, okay. It's all right. That's good. You say you want to ask a question?
Yes, sir.
Okay, please go ahead.
You're talking about this master class, and you are saying that without the licensing, we cannot be practicing, which is a good welcoming package. I really appreciate all your effort to ensure that social works is well recognized in Nigeria, because some people don't really, especially like us that is working in the medical health sector, we had a lot of challenges, but all of this is coming to an end, and that is a good stake and a good stand. I really appreciate it. Then for the renewal of the license, you're talking about if the license has expired, but you didn't tell us how to renew or something like that. And you talk about stamp.
Okay, yeah, licensing is renewable every two years.
Okay.
It's 2 years, yeah.
Okay. Then for those that is in the middle cadre that did maybe social work, psychology, sociology, did some other courses that is with us, and some of them that have done this, that is doing the program right now. Some of them are doing the program right now. Are they going to take another class after this diet 2 that they are doing? I'm not hearing you, sir.
Oh, sorry. So I've omitted now. So after the diet 2, for those who are on FIPE, so after the diet 2 workshop and examination, those who pass will be invited for induction. And induction, like we said, is at Enugu. So there's no exam again until after 3 years. Because every 3 years, you will be upgraded. Those who will be inducted from the FIPE Diet 1 and Diet 2 this year, they'll be inducted into associate member of the institute. So after 3 years, they'll be eligible for upgrading to member. Then after another 3 years or 4, 5 years, they will be 3 years into senior member, then 5 years into fellow. So, and each of those periods, they will do an assessment. There's an assessment form they will download on the online, they will fill it, and then the coordinator, their state coordinator, will also attest to it. And then if they scale through, they will then be upgraded. But for you going through the MCP, that is master class, you will not be inducted at the same level with those who are on the FIPE. You have a step higher based on your cadre.
Okay.
Yeah.
So which level are we going to be?
member, you'll be inducted as member of the institute.
So after 2 years before another, you still
After
accept
3 years. After
okay,
3 years, you
another.
now move to another level, another cadre.
Okay, sir. Okay, sir. Then for this, we're talking about this conference now, the seminar that is coming in Delta State. Is it for everybody?
No, not for everybody. There were selected few that were picked according to the resources of the government.
Okay. What about us in the Federal Medical Center? Can we join?
And I don't know about that. I'm not the one who is in charge of that. And we are not the one that is directly in charge of that.
We are not aware.
It is not the presented to us that we will train.
Okay, we are not aware.
Yeah.
It's okay. Thank you so much. Then for this conference that is coming in Enugu, is the accommodation issue is not discovered.
Let's leave the conference for now. The conference committee will release a memo to that effect to tell us all about what we need to know, accommodations and transportation and things like that. So that will be released.
Okay. Then lastly, sorry, sir, we have today we have about 2 arbitrary classes. So after the whole class, you said there will be, is it exam or question?
It's not exam, it's just an assessment.
Okay.
It's just an assess what you have learned so far, not exam.
Okay, sir. Yeah. Okay, sir. Thank you, sir.
You're welcome. So by way of introduction, let me just introduce the courses to us. In the next 3-5 minutes, we should be done with this interaction. Like I said, we have 7 courses in this module. Yeah, we have SWPCE-MCP-701, that's social work programming. That is to be taken by, yes. Do you have the timetable with you?
Yes, sir.
Okay, you have it. So, which will be taken by Dr. Iyeme. Then we have LWKMCP 702, the social work program design and implementation, will be taken by Professor John Emaimo. Then we have social work policy formulation and implementation to be taken by social worker Yakub Oni. Then we have social work case management, which is to be taken by Professor John Emaimo. Again, then we have 705, which is social work core competencies and skills, which will be taken by Dr. Kemi Otun, Associate Prof. Then we have social work cases and best practices, which is also be taken by social worker Yakub Oni. Then we have 708, the social work advocacy and campaign, which will be taken by Professor Oluwayemisi Obashoro John. So those are the 7 courses that will be going through during this period of interaction with you and your other colleague on this diet 2. And we want to believe that each one will avail him or herself to be part of the classes, but it's very, very important. You will discover that we have LWK MCP at 700 level. Whenever you see any, that is a postgraduate code. So even when if anybody is asking for a transcript, I will give it to them all over the world. They know that this is postgraduates. So, but then it's a crash program and it's an abridged program. Normally, this program should take about 6 months, but for the for the benefit of what we are doing. In the nearest future, it may take a normal mode, but we are just starting. So we need to just get some people in, so that to show the seriousness of what we are doing. But in future, it may be a 6 months, it may be a 6 months program, and it may not, and what will be paid will be more than this. So it is very important that we do this. It's part of our own effort to grow social work in Nigeria and to also extend to other parts of Africa, who have always been emulating what we are doing here. And I believe that at the end of the day, social work will be good for it. Practitioners will also be good for it. And for those of you who are working at the medical setting, it's very important that you go through this, those who are HODs, those who are directors, because very soon you may be receiving interns, social work interns from universities. Those who have just graduated, they'll be having 1 year of internship, especially in those who are in the medical field. So they will receive more of them to nurture them, to mentor them. So it's very critical that directors who are in the medical practice go through this to even know many of these ahead of time and be able to give better direction than we have had in the past. I hope you understand.
Yes, sir.
So it's okay, man. So thank you very much, man, for that. If there's no other question, I want to leave you for you to prepare for your class. It's already 10 o'clock.
Yeah, it's almost time.
Okay. Thank you very much, man.
Thank you, sir. Sir, are you from? Okay, that's good.
Ma?
Okay, I thought you have left me. I wanted to ask, are you from the Yoruba area, from the West?
Oh, sure. I'm Yoruba.
Because I've been saying it. I said, so. All right. Which state are you from, sir?
I'm from Lagos State.
Okay, sir.
From Lagos.
Okay, I'm from Ondo State, but married to Delta.
Yeah, my next of kin. Anyway, when I come to Delta, we will see.
Okay, sir. Thank you, sir.
All right, man. Thank you very much. It's a pleasure having you on this call.
Thank you very much. I appreciate it, sir. Thank you very much, sir.
Bye, man. Yes, man.
Yeah, bye, sir.